Hi everyone, my name is Karina Spencer, and this is a presentation on group discussion and essential teaching methods. Introduction. Group discussion is a method of teaching in which the learners and teachers share ideas, information, opinions, and feelings. This teaching method has also been called guided, collaborative, small group, or cooperative learning. The instructor's job is to guide the group discussion, answer questions, and maintain structure surrounding the learning objectives. This is extremely important because it's easy for groups to get off task or off topic. Emotions may get high, so it's important for the teacher to be able to keep everything flowing smoothly and on track. Domains of learning. Group discussion falls into cognitive and affective domains. An example of cognitive domain in group discussion may be to ask the group learners to demonstrate how to use a new piece of equipment that they are being educated about. And I have a little cartoon there with the brain beating up the heart, because it's cognitive, obviously, you're moving your brain, not your feelings. The affective domain is more emotional, which can arise frequently within a group discussion. An example of this would be asking a patient's family members to discuss end-of-life care for their loved one. Group discussion specifically allows the teacher to access the learner's emotions and experiences. In turn, this makes this method the ultimate tool for exploring the learner's beliefs and emotions about diseases. I have another little cartoon here, the heart beating up the brain now, and it says, all right, call her, because this is when our emotions are dominating. As you can see, there's a lot of pros for group discussion. They are cited in the status. Better understanding of educational material, increased retention of information, increased social support, better transfer of learning from one situation to another, increased positive interpersonal relationships, better attitudes towards learning, increased learner participation. The teacher can educate multiple people at the same time as opposed to teaching one person individually. That's also contributing to it being cost effective. Also, the learner can internalize the topic being discussed by reflecting on its meaning to them, and it allows for the development of learning of self-efficacy and cognitive growth. There's a few disadvantages of group discussion, as there is with any topic. The conversation can be dominated by one person in particular or people. The group may find themselves off topic. People who are not comfortable in the group may not participate or may be too shy to speak up. The teacher must be confident and able to redirect groups when needed. It may be time-consuming. Utilizing group discussion in health education for the patient. Group discussion for patients can be incredibly helpful for certain disease processes. An example would be diabetes. Group discussion is often utilized to educate patients with diabetes. One study found that a group discussion among patients with type 2 diabetes improved self-management of their chronic illness significantly. It's extremely important because of the amount of education that is involved with diabetes and the amount of self-management that patients have to do with that. And with group discussion with peer and community. Group discussions often utilized among peers informally as well as in college classrooms. In healthcare, nurses can discuss solutions to a problem of the group where everyone can offer input. And we often do this without even realizing that we're doing it and discussing issues in our workplace, in our facility, in our unit. It's, how we come to different conclusions and get different ideas. In the community, an example of group discussion is a town meeting. Conducting community health fair or education day could be a place that group discussion would be utilized. And even